Okay, so your analysis review for your final on Monday. On Blackboard, I have uploaded some different things. Let me go to it real quick. So on the side under PowerPoints and handouts, I uploaded like urine dipstick methodology and a urinalysis handout that kind of tells what each thing means, which y'all should know that, but just an additional resource. And on YouTube videos, I already have the vaginal wet prep up there that you were supposed to watch, but I know we didn't fully go over this, so just for you to kind of get an idea, a semen analysis test. It just kind of shows you from start to finish how that works. But what I told you the other day is that's the only thing that's gonna be on it regarding that. But I just uploaded it so you could see it. I uploaded that full Khan Academy series about the kidneys. So I would definitely watch that. It's a link and it takes you to all the videos. That's rather long, but I would definitely watch it. There's a video on here of them doing a fecal occult blood or a black test that I told you about. In here it shows you how to do a lumbar puncture to get CSF, and just bear in mind that these are done. It's YouTube videos and they're done on a person, but they're cadavers, so they're literally laying there dead. But I mean, it doesn't show their face or anything. So don't get like freaked out. And pretty much, you know, I mean, they're covered except the area they're working on. So I mean, you can't really tell if they're dead, kind of. But anyway, but it shows you the lumbar puncture procedure and how they collect the CSF. There's one that's showing a knee joint aspiration, like showing you how it gets the fluid out. A newborn screening specimen collection, and then how you kind of work a hemocytometer, just so you can watch them and correlate with what we went over in the book. So that's that. So you're gonna have two finals per se. You're gonna have the final that's over like all the book stuff, and then your lab final consists of just pictures. And I think it's like 22 or 23 pictures, and you've seen them before, so they were previously on your test. Okay, it's not like anything crazy. All right. So just looking at kind of chapter one. Chapter one goes back over quality assessment and safety. You know, this is talking about quality assessment, and then your pre-analytical, your analytical, and your post-analytical. This one talks about your turnaround time. What is the turnaround time? The time the specimen is received in the lab to the time the results are resulted to the doctor, okay? Not the time it is collected, because remember, you have 2 hours to get it to the lab. So the time that we receive it in the lab to the time that the doctor gets the result. This, you know, this chapter is just like your name and date of birth on the label of the urine, maybe the time and the specimen preservation that needs to be used. It talks about preventative maintenance and reagents. You need to have qualified personnel. Obviously, Joe Blow on the street can't come in and read a urine, okay? It talks about your external quality assessment, which is your proficiency testing. Everybody remember that? Okay. OSHA is good for who or what? Safety, standard precautions, universal precautions, we talked about that. So this should be fairly easy chapter. Talks about chemical hygiene plan. All that good jazz, okay? Chapter, we also did chapter 19 with the first one, it was, or no, excuse me, 18, 1, 2, and 18. 18 was the microscopy chapter. So just kind of read back over that. That should kind of be reviewed. Chapter 2 is talking about specimen types and preservation. What's the best and most common form of a urine preservative? Refrigeration. It talks about your random and your first morning and your time specimen. Which specimen would you just use to just perform a routine screen? A random. When would you do a first morning? Like pregnancy test. Time collection is like hormones and stuff like that. What if they had to do a culture, like a microbial culture? Midstream clean catch. So that talks about that. The different types of specimens like catheterized, suprapubic, where, you know, the needle is inserted into the bladder through the abdominal wall, your pediatric collection, why you may, reject a urine specimen. So, one of the main reasons you would reject a specimen is QNS. What is that? Quantity not sufficient. You ain't got enough pee there for me to do anything with. Talks about different types of preservatives. So, you know, the easiest and most common is refrigeration. However, remember that refrigeration can cause what type of crystals? Amorphous crystals. Chapter 3 is where it starts, unfortunately. Probably the best review for this will be to watch those videos that I have posted. And to just go back and read and go over the points that I went over. What are essentially the functions of your kidney? Filtration and reabsorption, and what else? Homeostasis, so acid-base balance. So, there are 3 systems that take a part in acid-base balance. What are they? Blood buffer, pulmonary, renal. So which ones only partially fix the problem, but they respond pretty fast? Pulmonary and what? Blood. which one completely fixes the problem, but it takes a while for it to happen? Renal, okay? How many nephrons does the kidney have? 1.3 million. Make sure you know, your renin, angiotensin, aldosterone, system and how that works. So if your blood pressure is low, which in turn would make your blood volume and your fluid low in your body, your juxtaglomerular apparatus is going to secrete renin, which in turn secretes angiotensin, which in turn secretes aldosterone, and that just tells the kidneys to retain water, because obviously if we're already low on water, we don't want to get rid of more water, right? So that tells us to retain water. And it would be the opposite if our blood pressure was high, right? We would try and pee more. What's the final site of urine concentration? Collecting duct. Make sure you know the difference between active and passive transports. Make sure you know your ascending limb absorbs electrolytes. Your descending limb absorbs water. Make sure you understand about your renal threshold levels, especially with the glucose. Um, kind of going on to chapter 4. When you excrete water, it's how much percent water, the percentage, and how much percent solute. 94% water, 6% solute. Make sure you know all the terms nocturia, diuresis, polyuria, oliguria, anuria, all of those. Make sure you know the difference between diabetes mellitus and diabetes insipidus. What three tests monitors like your kidney function? These two of them are like weights. GFR is one, and you get that with these other two. BUN and creatinine. Yes. On page 52. What does creatinine clearance, they prefer it to be a 24-hour urine. What does your creatinine clearance like really check? Yes, and what's that test called you just told me? GFR. So remember on like your blood work, when you get a BUN and creatinine, you get an estimated GFR, eGFR, remember? But when you do a 24-hour creatinine clearance, it is not estimated. It is a GFR, like down to the T accurate, which is how well your kidneys are. One thing I kind of missed in chapter 3, you know, they all kind of go together, but, what's the driving force behind glomerular filtration? Hydrostatic pressure, it's on page 31. And where does water reabsorption not ascending? Make sure you know kind of what influences like urine excretion. So for example, diarrhea would, right? Because obviously you're going to get rid of more volume. Drinking a lot or drinking certain beverages like alcohol and caffeine, that would influence urine excretion. Exercise would. So make sure you know that. The final osmolality of urine, where is it determined? On page 54. Distal tubules and collecting ducts. What is osmolality? What does that tell you? The ability of the kidney to do what? concentrate the urine. So on a dipstick, how is that determined? Specific gravity, yes. So what's the difference between osmolality and specific gravity? So they both tell you about concentration, right? Specific gravity is only ionic solutes. Osmolality is all solutes. What's a normal specific gravity? One point zero zero two to 1.035. How do you measure creatinine? Like it's called a blank reaction. Starts with a J. Jackie reaction. Make sure you know your creatinine clearance formula. And remember that U is the volume or the urine concentration of creatinine. P is your plasma concentration of creatinine. And remember, it's ml per minute. That minute is 1440. Because you have 1440 minutes in 24 hours. And then the SA is the surface area. How do you screen for albuminuria? It's it detects it before your dipstick protein could. Microalbumin. So your routine analysis, what gives the urine its yellow color? Urochrome. When you spin a urine down and you have pink sediment, which is called brick dust, which it'll be amorphous, right? What's the cause of that pink dust, that pink color? Uroethrin. This with foam, if you shake it and it's foamy and it's white foam, what do they have in their urine? Protein. If you shake it and the foam is yellow, bilirubin. Clarity, make sure y'all kind of know the difference in that. Obviously, if it's clear, it's probably okay. But if it's cloudy, it might be infection or inflammation and stuff like that. Odor. Remember how sitting it out at room temperature, it'll cause that ammonia-like smell. Other odors like, and then if you talking about chapter 8, like the mouthy odor is PKU, phenylketonuria. The caramelized odor is maple syrup, urine disease. So just make sure you know to correlate. If you see cast, it is a what type of UTI? Upper. if we look at a urine and, we're looking at it and it is like, super clear. And then we looked at another one and it was like dark. Okay, what could we probably say about the clear one? Huh? Less concentrated, so you could probably look at it and tell, hey, this one's specific gravity is probably gonna be low, or, low. This one's probably gonna be high, because it's based on like the color and how concentrated it is. Chapter 6 is strictly your, chemical analysis of urine. And of course, storage, make sure you know, keep it away from heat, light, moisture. Make sure there's no discoloration of anything, all that good stuff. Specific gravity, we pretty much already talked about. pH, what's the normal pH? Yep. And pH gives you what? Does it tell you? Acid-base balance. Protein, your main protein is what? Albumin. Speaking of like protein and Cas contain what protein? Uromodulin, which is also known as pan-porcitol. And if you have a good bit of protein, what does probably that indicate? Huh? Yeah, upper UTI or, you know, some type of kidney damage, right? What does an orange color here indicate? Iridium. How could you tell the difference? So like with blood can be what three things on the dipstick? Red cells, hemoglobin, myoglobin. On your dipstick, if it is spotted green, it's intact live cells. Okay, that's what that means. So intact live red blood cells. How would you know the difference, like between a hemoglobinuria or a true hematuria? Look at it under the microscope. Obviously, if you see red cells, it's hematuria, right? If you don't, it's one of the other two causes. Leukocyte esterase picks up all white cells except lymphs. When you have leukocyte esterase present, what does that mean? Infection or inflammation. Nitrite, what does that mean? Huh? What kind? All bacteria? Okay, so, and then of what class? Gram negative, gram positive? gram-negative, gram-negative nitrate to nitrite reducing bacteria. Most UTIs are of what origin? Huh? What? Yeah, so they're usually what class? Gram-positive, gram-negative? Gram-negative, and of the UTIs that you get, the bacteria that you usually get is what? E. coli. And is it a gram-negative cocci or a gram-negative rod? Gram-negative rod. Yep. What can cause a false nitrite? It sit out too long because bacteria proliferate. Why would you use KOH? It lyses red cells and you can see yeast. What's it mean when somebody has glucose in their urine? Huh? They have diabetes mellitus, and what has happened for that to take place? Their renal threshold has been exceeded. Their plasma glucose is over what? 160 to 180. Which two sugars signify a pathologic condition? Glucose and galactose. How would you know that somebody has galactose? Huh? Clinic test. Which is also called a what? Starts with a C. Copper reduction test. Ketones. What odor? Huh? Sweet, fruity odor. What's it indicate? They are burning fat, not carbs. So they cannot utilize their carbs. They're either not eating carbs, something, okay? So with this, diabetes, usually type 1, they're dehydrated, super dehydrated, they're on fad diets. All of that can cause ketone formation. What's the tablet test for ketones? Aspartame. Bilirubin and urobilinogen. What do they kind of indicate? Liver, could be obstruction. What's the tablet test for bilirubin? Huh? Icto test. I might be wanting to get my list, little things she's got over there. What's the reference range for urobilinogen? Less than 1. What's the test for urobilinogen and porphobilinogen? Watson-Schwartz test. What's ascorbic acid? Vitamin C. So the next section, chapter 7, is simply microscopic. So how would you do a microscopic urine? Pin it down and view the button or sediment on what 40. So make sure you know the different things and what they look like and what they mean. What are clue cells? Epithelial is covered in bacteria. Make sure you know all the and the main ones that you should know. So like Effie's, white cells, red cells, the certain casts like Highland cast and mucus, whenever they look very similar. Yeast and red cells look very similar. You have budding and pseudohyphae yeast. Tricks and STD, jerky, flitting movement. This is true for wet prep and for urine. Make sure you know what a waxy cast looks like. Granular cast. Trick. What did we say KOH was for? E. What's one of the main urinary parasites? Or actually the true urinary parasite? Schistosoma hematobium. Where's the spine on it? The little spine, the little tail at the very end and the very back. What is Enterobius vermicularis? Pinworm. Make sure you know what that looks like. And of course, like amorphous, firm, calcium phosphate, calcium oxalate crystal. Calcium oxalate is the squares with the X's. Calcium, triple phosphate looks like the coffin lid. Bilirubin crystals kind of look like glass shards and they're yellow. Ammonium biurate is thorny apple. Cysteine crystals look like it's like a hexagon. Tyrosine crystals are needle-like. Those are really bad ones. Chapter 8. talking about your renal and metabolic diseases. Oh. This is the one I think is really bad. Glomerular injury is primarily from what type of process? Immune process. So like glomerular nephritis. One way to get glomerular nephritis is to have this type of infection go untreated. No. Not that. Strep, which strep? Strep A, strep throat. Strep A. So, what test can you do to see if somebody's had? Oh my gosh, let me finish. A recent strep infection, ASO. What are the two streptolysin? O and M, yeah. That wasn't your analysis, but streptolysin O, ASO, and the other one streptolysin, yeah. When somebody or a patient has nephrotic syndrome, so their nephrons in the kidney, what are you going to expect to see? Protein, okay, so that's on your dipstick, so protein, so you should expect to see CAS, yes. Going back to streptococcal, post-streptococcal glomerular nephritis, what must that strep have in order to cause disease? CM protein. Remember that to get kidney disease, so like nephrotic syndrome, lupus, diabetes is another one that can cause kidney disease, so make sure you know all those. It's in chapter 8. Amyloidosis, that's the one that is a precursor to Alzheimer's. Tubular disease and acute tubular necrosis. So this disease is not good on your tubules in your kidneys, and it releases myoglobin in your muscles due to injury. Rhabdomyolysis. One that was not on your test that I want you to know, I'm gonna give it to you, page 224, Fanconi's syndrome. I think we highlighted it. Did we highlight Fanconi? Okay. So Fanconi syndrome, you go down a little bit more, it says loss of proximal tubular function. Let's start on that. That is what Fanconi syndrome is, and that will be on your file. Because I know we did not harp on that one regularly. Renal calculi is what? Kidney stones, and they are usually what makes up those kidney stones? Calcium oxalate. What species of candida is usually causing yeast infection? Candida albicans. Make sure you know your metabolic diseases and amino acid disorders. Yes, it was this chapter. So amino acid ureas or inborn errors in metabolism. So PKU, mousy musty odor, Guthrie microbial inhibition test, maple syrup urine disease, caramelized odor, alkaptonuria, homocysteine, darkening of the urine. Usually, diagnosed later in life versus the other ones, they're diagnosed when they're born. I forgot to mention this, Clinitest tablet. So for reducing sugars, what age group? Less than 2. Make sure you know, once again, the difference between, diabetes mellitus 1 and 2 and diabetes insipidus. Chapter 9, CSF, brain and spinal cord. What is a discoloration of spinal fluid called? Huh? Xanthochromia. Do I really need to go over these since we just had a test on it? I mean, it's the same stuff that was on your test, legitimately. If you see neutrophils, it's usually what? Well, what type of infection? Neutrophils, bacterial, lymphocytes. What, make sure you know your total protein and your glucose ranges. This, is the most commonly determined to assess the integrity of your blood-brain barrier. Huh? Yeah. Make sure you know, like in chapter 10, everything that we went over, like a fusion a fusion and then transudate versus exudate. Exudate's inflammatory, transudate's non-inflammatory. Positive microbial cultures, you usually are apt to get a more positive culture when you gram stain and culture the what? The button. Make sure you know the difference between thoracentesis, pericardiocentesis, and peritoneal centesis. What crystal indicates gout? No. Well, then that was too. In synovial fluid,
Oh, you didn't specify.
monosodium urate crystals.
Man. Let's see if you did anything on your shirt. On that mark.
I don't have a thing.
Oh,
Nope.
on that mark. In the vindication. I want all of these stuff in there. The emergency field.
Make sure you know, what's the acid fast thing for? TB, gram stain, bacteria,
She's ignoring me, right? Are you ignoring me?
no, I'm trying to hurry.
You're not looking at me. Look at me.
Hold on.
I'm about to be like Jack. I'm about to throw a tantrum up here and be gone.
Anti-diuretic hormone, what's it regulate the reabsorption of? ADH water, yeah.
Go with you. Bye, Rebecca James.
Hold on.
I've been holding there for a long time.
Okay, pretty much it. And then all the other stuff I told you about the semen, the poop, and amniotic.
What's your semen pH? Exactly. Know it. I mean, all of these are different.